WHS 2025 is underway in Berlin under the theme Taking Responsibility for Health in a Fragmenting World. The summit seeks to improve global health in an increasingly tumultuous world. The three-day forum centers around science-led interdisciplinary approaches to tackling pressing global health concerns. To discuss this further, we are joined on the line by Dr Geetha Krishnan, who is World Health Organization TMC Unit Head for TM Research, Data and Innovation. Dr Krishnan, good morning to you and thanks for making time.
Good morning, Asanda. It's great to be here. Thanks for inviting me.
It's our pleasure. What is on the agenda, Doctor, and what are some of the issues that are being discussed at this World Health Summit in Berlin?
Well, you have rightly pointed out that the theme is very contemporary. It talks about the responsibility that all of us have, not only the governments but the people and the organizations like the WHO in making sure that health is held at highest point of need for the people, and as well as well-being of the planet, as well as people who are living there. It is a fragmenting world, and we need to find answers and solutions together. And this particular summit is focused on this very important agenda. We also see that they are very focused on using science-based interdisciplinary solutions, and that's where the area of traditional medicine, which is an area where we are working in this, comes to focus.
The University of Medicine in Berlin and the World Health Organization convened a panel session on exactly what you touched on now, the traditional, complementary and integrative medicine. This was titled Operationalizing the WHO Traditional Medicine Strategy from Global Vision to National Action. How does this strategy complement the universal health coverage?
This strategy, which is for a period of 10 years from 2025 to 34, is primarily focused on making sure that science-based, evidence-based traditional medicine is appropriately incorporated into the health systems globally, so that it is made equitable and available to people in need, as well as to people who are demanding it. Now, this has a long history, and one of the main things that this particular strategy is focusing on is creating appropriate evidence for traditional medicine to be integrated using different formats of collaborations and partnerships, and also health systems policies. So these four areas of work, which means science, creating evidence, creating integration, creating collaborative partnerships, and also working together in building strong networks, and for undertaking this is the major focus of the traditional medicine strategy in the coming 10 years. And we are intending and have also have started working closely with governments to make sure that this could be undertaken and delivered appropriately.
How will this mark a pivotal shift in global health systems and the way that we think about global health systems, the strategy that you just underpinned?
In global health systems, traditional medicine has played always a role, but a very minimal role, a very inconsequential role. This strategy makes it very evident and clear that the role of traditional medicine cannot be inconsequential or relegated to the corners, because the population across the globe, billions of people, use traditional medicine, and it is a global necessity and need for the people. And it also makes sense because it is already providing care to billions of people. And if that is not that resource, where we are talking about a resource scarce environment, if that valuable resource is not being appropriately used, it is actually a loss for everyone. So this strategy is a pivotal moment, because it tells the governments on how to do it based on science-based evidence, how to do it based on proper collaborations, how to integrate and create how to create policies so that integration can happen at the right level and in appropriate formats.
So when and how will this strategy be implemented at national and regional levels, and how do we ensure that it is appropriately implemented?
In fact, the implementation of the strategy will start or already has started. We have already initiated discussions in different formats. One of the main areas where we are going to have this global discussion is during the second WHO Traditional Medicine Global Summit, which is going to happen from 17th to 19th of December in New Delhi. So this particular summit, we are inviting multiple global agencies, including national governments, to discuss on how to implement this strategy and create an action plan, which will then be rolled out in the next 10 years till 2034. That's the plan.
All right. Traditional medicine practices ranging from herbal remedies and acupuncture to yoga and indigenous therapies are often used as the first line of care for many, especially those who are in rural and underserved communities. What does its widespread use underscore?
As we alluded earlier, this widespread use says that there are already existing usage for these practices from around and across the globe, and millions of or billions of people use it. Now, the question is how does health systems appropriately make sure that they become valuable resources for providing health and well-being to the people? And that's exactly what we are trying to do with the new traditional medicine strategy, and also during the summit to create an action plan in a collaborative way with member states as well as of WHO member states, as well as with appropriate and valuable institutions across the globe to implement this.
Well, I guess it's after this, then straight to New Delhi for the 17th to 19th of December. So you've got a lot of work cut out for you, Doctor. But we thank you so much for your insights this morning.
Download the SABC app and take